we're getting ready to go live. We are on air now.
Can you read this for us? Do you remember Mike Richard? Roy? Yeah, we saw him earlier today.
Hey, Roy. We are live.
Impersonating civilians.
Okay. Yep, we should be live now. Okay.
Good evening. Welcome to the May 2019 Low Carb Support Group meeting. We're glad that you guys all could make it tonight in person and on the live stream. We are live. So that if anybody, if they want to ask questions and they don't want to be on camera, then when you come up to ask your question, we'll just stand behind the camera right there. So, all right, tonight, Dr. Westman is going to talk to us about keto medicine, what we've learned from clinical research in keto treating 63,000 plus patients. So, looking to see if there's any other notes I need to. Nope. Tonight we're just going to have Dr. Westman speaking with us, and then we're also going to answer a few questions. I believe Lisa says she has questions. I believe I got a text saying that Lisa had questions. So. And also we'd like to hear your stories too. So without further ado, Dr. Eric Westman.
Thank you, Amber. And with the logistics here, is it okay if I stand here?
Yes, you're perfect.
Fantastic.
Perfect.
Welcome, everyone. And how many of you are doing a keto diet? Raise your hand. Keep your hands up. How many of you have been doing a keto diet more than a year? Keep your hands up. More than 2 years? 5 years? 10 years? 20 years? I win again. Just wanting you to see you're not alone. In February, I went through 3 different towns in the Midwest and South, I guess South, and there were 200 to 300 people at each Saturday with hands raised high, just this last February. And so you're not alone, and I'm hoping you are sharing the word, spreading the word in this kind of grassroots movement that's happening. So thank you for coming out tonight. After the slides, I'd like to open it up for discussion, share your successes, your problems that you're having. That's usually an important part of getting together like this too. So I gave a version of this talk at Low Carb Denver, Low Carb Keto Denver, and I'm happy to give it a little kind of a revision of it as well today. So keto medicine, have you heard of keto medicine? Well, no, because I just made it up. Excuse me, it's a neologism. Just made the term, but I think it's going to stick. So how I got started in keto research, 2 of my patients at the VA hospital in Durham, that's just down the street, they did this crazy diet of eating steak and eggs, having lost all this weight, and I was curious. So they said, we went Atkins. And I really didn't know what it was. I looked at the book at the bookstore, wrote Dr. Atkins a letter because I thought he might be useful to learn from. And then I asked him if he needed to do research, and he said, well, I have all the evidence I need from thousands of patients. Basically, why do I need to do research? I know what the research will find. I've been doing it 30 years. So, but he did break the ice and say, come see for yourself. And that was brilliant on his part, and it's what I do even today. 20 years later, because a lot of doctors still won't believe it unless they see it. So that's why I have an open door policy in my clinic with people coming from all over the world. Pietro, I could stand up and just say hello. And where are you from?
Yeah, sure. Hi everyone, I'm from Rome, Italy, and I'm here observing Dr. Eric Westman in order to learn more about the keto diet.
Oh.
Fantastic. And so we have some visitors from China as well. Say hello and Thank you for coming. Again, people don't believe it unless they come to town to see it, even today. So, I returned skeptical going back to, that's me here. You probably didn't recognize me except I put me there. And Dr. Atkins, and then Jackie Everstein, who's still in the game. I sat in her office, and she's been just so helpful through the years. But so I didn't just start doing this. We started to do research. And Dr. Yancey and I have been studying this ever since. Will Yancey is still funded through the Veterans Affairs Medical Center or Research Program, Department of Veterans Affairs. But so after 21 years, and all of the research that we've done leading to at least 46 peer-reviewed papers on the keto diet, also known as LCHF, low carb, high fat, based in Sweden. Diet Doctor uses that language. We opened a clinic at Duke in 2006. I helped to write 3 books and started 2 new companies as a result of it. And I learned it from a doctor who invited me to speak at their conference to say that I believed in it so much I bought the company. Apparently among entrepreneurs and business-minded doctors, that's a great thing to say. In fact, I founded the company. I believed in it so much. So at Duke, I know some familiar faces of people I've met through the Duke Clinic and the HEAL clinics. We've treated patients with metabolic and inflammatory problems like obesity, type 1 and 2 diabetes, including gestational and postpartum diabetes, PCOS, which is a cause of infertility in women, polycystic ovary syndrome, irritable bowel syndrome gets better, all of these get better. Non-alcoholic fatty liver, which is a common cause of liver transplant today in the US, getting better. GERD or acid reflux, lymphedema, lipedema, which is a different type of kind of unusual obesity that occurs. Come on in, come on down, there's some more chairs here in the front as well on this side. Cardiovascular, we treated people with heart failure. If you think this is bad for the heart, why do the heart doctors send me their patients? So enlightened doctors who know about metabolic syndrome and insulin resistance will send me their patients, even the cardiologists. Post-bariatric surgery, weight regain, people think that the surgery is going to fix it forever, and it doesn't unless you change the lifestyle as well. Also, weight gain caused by other medicines. I find that I'm in this kind of fight or just a different, I screen for other doctors giving pills that cause the weight gain or make the diabetes worse. So there's something that's going on in the current medical care that just doesn't fit with what we're doing, which leads me down the path that we need to do something different, train people differently. Keto is one of the only interventions that puts type 2 diabetes in remission, but if you even go to an endocrinology clinic, they don't talk about remission of diabetes. They put you on more medicines. This is just a graph that shows you add up all of the total insulin units for the day. The diet is so powerful on the first day, you have to cut the insulin in half. Otherwise, the blood sugars will go too low. So don't do this on your own if you're on insulin or diabetes medicine without someone who's helping you, who understands how to do it. So what this graph shows basically is this person was on 100 units of insulin, the blue bar, and by week 3, that person was off insulin. And the blood sugars were better than before. Of course, they're not eating carbohydrates. And here, just about everyone gets off insulin by week 7. This one gentleman, I still know was on 500 units of insulin in a wheelchair going around. Now he's walking around and still on insulin some years later because he still has a lot of weight to lose. So that's going to be the answer for type 2 diabetes. It's not just the food change, it's also the weight reduction to fix the underlying insulin resistance. So it's really a 1-2 punch with a keto diet. You get the blood sugars coming down because you get rid of the food that raises the blood sugar, but then the weight loss gives the ultimate fix or remission for the type 2 diabetes. This is not a conversation that's had in the traditional endocrinology treatment that we teach all across the country, all across the world. It's a conversation that has to be had, though, right? So let me just, it's all about people and sustaining the weight loss. This person lost 230 pounds and kept it off. Before and after pictures saying, for the first time in my life, I'm no longer at war with food, the scales, and best of all, myself. Pretty amazing how that can work. And this person lost 130 pounds, eliminated all the medications after decades of diabetes. So you can put diabetes into remission and fix it, or cure it, actually. So she said, after 10 years taking diabetes medicines, my doctor prescribed insulin. I searched for a better answer because I didn't want to have diabetes in the first place. The diabetes went away with the low-carb keto diet, no more medication. Again, this is not a conversation that's had. I'm an internal medicine specialist. Doctors just aren't trained to know about this, but we do it all the time. So the A1C, which is a reflection of the diabetes over 3 months, it's an average of the diabetes blood sugars, is now normal after the weight loss as well. So that's pretty amazing. So in 2014, I helped to create the HEALcare program, the HEAL clinics, with Jackie Everstein. Jackie was the nurse whose office I sat in Dr. Atkins' clinic in 1998. And she was treating and educating at the Atkins Center from 1974 to 2003, and then steered me into keto medicine in 1998 and joined Artery at the HEAL clinics in 2014. She is probably the most knowledgeable person alive about the keto low-carb diet, and she helps not only in videos and wrote a book called Atkins Diabetes Revolution. She's also helping with the educational program at the HEAL clinics. And it's just amazing to be able to have her on our team. I'm really happy about that. So there are 4 key conclusions that I'd like to just really hammer home after treating 65,000 patients or more. That's combining the Atkins Center and the Duke practice that we've had. Number 1, keto is safe. Keto is safe. Just say it like it is. It is. Someone says, oh, but what about it? Keto is safe. Number 2, keto is effective for more than type 2 diabetes, prediabetes, and obesity. Keto works for virtually everyone when it's done right. We'll get into that a bit. There's a lot of confusion out there. And then keto requires a new medical normal. And this will help you when you're looking at the lab values, comparing it to those people who eat carbohydrates. It might look different, and that's okay. So keto is safe even if this myth lives on. You went on Atkins and lost 90 pounds, lowered your cholesterol, cured your high blood pressure, and now you're walking 5 miles a day. But I'm warning you, a low-carb diet is bad for your health. Have you heard that lately? Right? Yeah, still nods going like this. We want to try to dispel that myth because the research is there. Research and clinical experience are clear and very compelling. And now it's a way we need to find ways to get the information out easily, succinctly. There are 2 ways. So the body of evidence surpasses the FDA phase 3 requirements for approval of a new drug. So if it were a drug, it would be FDA approved, basically. But there's no process for diets to be approved through FDA. Now, we've summarized the evidence in a pretty user-friendly format from HEALclinics.com. You can download this brochure about the evidence. And if even that's too much, you can, on your app, on your phone, or your internet connection, go to the Public Health Collaboration of the UK.org/RCTs, and you can get a list of all of the clinical trials showing how low carb and low fat compared side by side, or this infographic showing just how many times low carb versus low fat that low carb did better, and the score is 31-0 that low carb did better over low fat. So it's not that low fat can't work, but it's just low carb works better. So there should be no question that keto is safe, it's effective, just like if a doctor was prescribing a drug for you that was FDA approved. Number two, keto is effective for more than type 2 diabetes, prediabetes, and obesity. And while the science is published in regard to these conditions the most, any of the conditions that are related to insulin resistance or hyperinsulinemia and blood glucose also can get better. And it's exciting to see the emerging research on not only heart disease, risk factors, epilepsy, acid reflux, which we talked about. There's also emerging science on rare conditions like glycogen storage diseases, where nobody really thought that maybe the individual would do better by burning fat as fuel and not sugar. And again, for you old timers, I mean, people who've been here before, how do you turn your body into a fat burning machine? Just don't eat carbohydrates. Yeah, so that's, I know many of you have been here before, you're well coached. So libido is better, erectile dysfunction, traumatic brain injury, pain management, and the evolving science, which we're watching carefully. I'm not ready to sign off yet on it for, like a drug, like FDA approved, but the data on neurodegenerative diseases like Alzheimer's, Parkinson's, and dementia is pretty interesting. And even watching new therapies like keto, exogenous ketones can actually influence tremors, or one of the problems with Parkinson's disease, even if someone's eating carbohydrates. So ketones might even become a drug when people are eating carbs. But imagine this happens also when you just don't eat carbs. You get these ketones going, and so you don't have to take those ketones. But that science is pretty interesting. And then cancer, kind of the big, holy grail to find something to help cancer goes way back to the idea that lots of cancers run on sugar, although it's more complicated than that. But most experts now are at least kind of nodding that, yeah, you don't want to eat a whole lot of sugar if you have cancer, but there's not studies saying that it's going to be effective on its own yet. But it's pretty exciting to see this research evolving. This February, I was at the Metabolic Health Summit, and new science is being generated now all over the world, which is great. So should we consider keto medicine a new medical specialty, treating keto treatment-centric rather than condition-centric? And the reason we say this is that keto treats all of these things, and yet none of these subspecialties knows about it. So we joke that the heart doctor knows that there's potassium in a banana, and that's about it, what they know about diet, or that the Mediterranean diet is best, even though there really isn't much evidence that the Mediterranean diet is very good. And then metabolic endos, only they know how to treat diabetes by giving medication. You don't have to use medication, there's another way to do it. Neurology, cognitive impairment, instead of using other medications, why not use a diet change like this? And then GI doctors, who you would think would know something about food, because you eat, and then it goes in your GI tract. Remarkably, most, I'm afraid, don't. They've become, a lot of these subspecialties have become procedure-oriented, and they don't really understand that what you eat might impact even things like inflammatory bowel disease, or irritable bowel disease, or even heartburn. So you can treat all of these. So these are the internal medicine and neurology disciplines by just using the keto diet, which is pretty impressive. That's why I'm leading down this path that we should have a keto clinic or keto medicine, maybe even in an academic setting, and it's pretty exciting actually to see that. And it may actually happen. Keto works for virtually everyone when it's done right, and I'm watching an explosion of keto this, keto that. You gotta have keto this, keto that, keto drink, keto cookie, keto all. No, you don't have to do that. Remember, the best way to become a fat-burning machine or keto is to just keep the carbohydrates low. So a lot of people just don't know yet that you have to keep the carbs at under 50 or even 20 total carbs per day, total, not net, and then it becomes just about universally effective. And what this shows is that it becomes a low-calorie diet, even though you don't count calories. So pretty effective for weight loss, any condition that has to do with elevated insulin or elevated blood glucose. Did you know the typical American diet has about 250 to 300 grams of carbohydrate a day? Yeah. And then the calorie level is much higher. So understanding how to do keto really is uncomplicated, and it fits in a sheet of paper. There's no squint, you don't have to squint, you can download this from HEALclinics.com. And basically what we say is eat as much as you want of the proteins, the meat, poultry, fish and shellfish and eggs, a little bit of leafy greens and vegetables. Then you can have some cream, cheese, oils, mayonnaise. Those high calorie things have to be limited because they can work that automatic calorie reduction if you're trying to lose weight by doing this. But with keto medicine isn't the most important therapeutic factor. We're not prescribing pills. The physician's primary role is to counsel, to listen. So teaching a doctor to listen, can you believe that? Actually, I think we will select out people who already kind of do that naturally. You listen, you understand, you encourage, you support, you uncomplicate. This really is a holistic or integrative type of practice, because if you think of food as medicine, you'd rather talk about cauliflower than metformin. How about that? Lead patients with cauli rice. Have you seen rice cauliflower at the grocery stores, and cauli tots and cauliflower, mashed cauliflower tonight at dinner? Let patients tell their story but never dwell on it, so there's no shame, no guilt, no embarrassment. One of the practitioners who filled in for me recently was very excited to see that I didn't have any judgment. It's a non-judgment zone, and it really works well. So this is kind of the basic, stick to the basics too, no gimmicks. You don't have to buy this newest shiny thing. You don't have to track things. Every new day is a chance to start again and go back to the allowed food list. I had lots of food lists, so I would say, do you need another food list? And bring it out of the cabinet. I think I have a bunch there that get replenished. And I've seen eyes roll when I give them the 10th food list, but it's so important to know. I think maybe we should quiz people on the food list. And, it really works. So whether it's working or not, you have to discover what people are doing. On the far left, this individual wasn't losing weight, so I wondered there might be some carbs creeping in. And on the form, I don't make people write things down at home, but I'll ask them to write things down at the clinic. And on the form, she wrote pineapple water. And I thought, there was lemon allowed and all that. So I said, well, how do you make pineapple water? She said, well, I take the can of pineapple and open it, put it in the pitcher. And I said, with the syrup? Oh, yeah. And then put some water in. And is it sweet? She said, oh, yeah, it's real sweet. And so, but I never said she couldn't have pineapple water. Never mentioned it in the initial class. I think there's another place in people's brains for tea in the South. It's really sweet tea, but it doesn't fall under the sugar-containing beverages part of the brain for a lot of people. This fellow in the middle, he said, I'm doing your diet all but 1 minute a day. I'm doing 29 hours, 59 minutes, and 30 seconds, all but 30 seconds a day. I said, well, what are you doing in that 30 seconds? Well, I'm getting up in the middle of the night, having Oreo cookies and milk. Well, your diet's not working. Well, wait a second. But if you don't sit down in a class and learn it, you might not realize that you really have to do it all day long. Because if you're a fat burner, you're using your fat enzymes, you're revving them up, and then you eat some carbs, it might knock you out of ketosis for a week or two, knock you out of the fat burning. Ketosis in the urine or breath or blood doesn't necessarily mean being in ketosis. There are ketones that you can measure, and that causes endless frustration. I'm losing weight, I have no hunger, everything's great, but I'm not in ketosis. No, that's not the focus. You want to have all of those other outcomes, because the tests aren't perfect yet. We don't fully understand why, but So don't emphasize the measurement of ketones even. Now this fellow, the other thing is, I do believe you if you tell me you've been strict, but he didn't lose weight. He had lost weight every month. Now this month he didn't lose weight. And I just kind of said, well, what else happened this month? He said, well, I had an operation. Well, what? I got a new leg. He had a prosthetic leg, and he got a new one, but this one had a Duke front and a UNC back. So it added 5 pounds to the leg. That's why he didn't lose weight, because the leg got heavier. So always believe, trust, knowing that sometimes people don't even write down their middle of the night Oreos in their myfitnesspal.com sometimes. So that's kind of fun. It's very gratifying to help people figure out where they're stuck. And that's one of the things that I found I do a lot these days. People get started and not doing it quite right. But people fail mostly for psychosocial reasons. It's not that, the list is simple, right? Simple, the food's there, but it's not so easy all the time. So unrealistic expectations and prior experience, you might apply old habits to a new diet, or you're discouraged to try yet another diet thinking that it's all going to come back. But actually you do this, it's going to stay off forever, as long as you don't go way high on the carbs, you gradually reincorporate them, or maybe not incorporate them at all. Complicated, incorrect, or confusing programs have blossomed over the last couple of years. This app, that app. I got talked into using some of the apps, and I got tired of being reminded about, how was your lunch? Well, I didn't have lunch. It was irritating. You didn't eat enough protein today, the app tells me. Well, I let my body tell me how much protein, not the app. So be sure, what we teach is listening to your body for those cues, not for what the app is designed to tell you. The opposition by medical establishment, just coming back from a couple trips to Asia, the lack of pushback in Indonesia from the medical establishment has let this blossom, and people call themselves keto warriors, and they call themselves living proof of the benefit of how it happens. No one in the countryside there is measuring their LDL cholesterol to be told, don't do that, So, let that aside. Don't worry so much about the opposition. Ask for data, ask for your doctor why you're thinking something. Talk to someone who's familiar with keto medicine. Friends and family, of course, there are already saboteurs and carb pushers, especially around the holidays. Stress is a big one, probably lowers metabolic rate or makes you want to eat carbs for the emotional therapeutic eating. It's okay, we just have to help you develop other methods of stress management. Physiology and side effects of medications, carb addiction, cravings, and hunger. Of course, you can treat those things, but if you just wait until the time passes, most of the time the cravings and the addictive element of it will go. How the body works and changes over time. We actually think of obesity, if you're using this for obesity, as a different disease at different time points. So what works at the beginning may not work in the middle or the end of the process, and we understand that. So sustained lifestyle change requires integrative coaching for most people. Now, some of you have done it on your own, some of you can do it on your own. Most people need some coaching or help at first, and why not ask for help? I mean, it's like struggling out on the, see you next time. Is that Jen? So why not get a coach, a personal trainer at the gym, for example? Why not get a coach to help you with the lifestyle change? So what our HEALcare counselors and coaches do is they educate, guide, support. People have already been doing it for a long time, have a lot of experience, special training in this, develop realistic expectations, they assess progress, promote the accountability, and prevent adverse events or adverse effects by reminding you of the things you can do to not get fatigued or not to get muscle cramps or things like that. So in the HEALcare for Life system, we have one-on-one support from the partner, and then live peer support groups so you can get connected to other people who are doing this in real time with you. They're trained coaches and facilitate conversations around all different topics, whatever is the barrier of the moment. So it's been pretty fun to put together this kind of program. You can do it every day as a chance to continue or start again. If you had lifelong issues with weight, you're waiting for the day when you just totally relapse and you regain it all. And I've talked to many of you or others where there's this just mindset of I'm waiting for the shoe to drop for it to fail. No, it's not going to. Yeah, it's not going to, and we'll remind you of that. So this person said it began in my 20s with reactive hypoglycemia after my blood glucose shot up and plummeted to 30 thanks to the sugary breakfast. If you're not familiar with reactive hypoglycemia, yes, sugar helps you out of it, but it's sugar that got you into it in the first place. Because the blood sugar goes up and insulin goes up, it's an overshoot, and then the blood sugar goes way down. So the way to fix it is to not eat the sugar in the first place. So the endocrinologist diagnosed polycystic ovary syndrome, put me on diabetes medicine, depression, more medicine, gestational diabetes, then insulin, insomnia, a sleeping pill, a downward spiral, high blood pressure, started low carb, lost 100 pounds, regained them because I deserved cheat days. So I'm not a big fan of cheat days. In January 2016, something clicked during my first low carb meeting. And today I'm proudly living my dream, medication-free and healthier than ever. It's pretty amazing. And these aren't just isolated case reports or case studies or anecdotes. We put together some preliminary look at the data from the HEAL clinics. So this isn't research, this is really what happens. It's not a study where you have all this extra stuff, this is what happens today. So on the left side, when people are in the medical program, this is why I say, it's going to work if you do it. Because everyone here, each bar represents an individual with the weight loss in pounds on that axis. All of these two people lost weight. So if you do it, it's going to work. In the non-medical program, again, these people were not able to do it for various reasons, or were doing other things other than weight loss. And you can see that that just about everyone has substantial weight loss. Okay? And then for the diabetes, same thing that we saw in research studies. It happens in the clinical HEALcare world, where the beginning and ending hemoglobin A1Cs go down on less medication, and in graphical form, here's what you want to see: a before hemoglobin A1C reflection of diabetes, and an after improvement on less medication. Switching gears, keto requires a new medical normal. And if you haven't heard this before, you may have to hear it a few times. Because keto doesn't fit in to the macronutrient composition, because we're not eating carbs. And everyone's supposed to eat carbs, right? It's normal to eat carbs. Eating behaviors, we were talking at a meeting, traditionally trained eating disorder professionals think we all have an eating disorder because we're not eating 5 times a day. We're not having 3 meals and 2 snacks. We might even be eating once a day. Some people look at that and say that's an eating disorder. No, it's not. You're eating when you're hungry, you're getting the nutrition you need. Your ketone levels may be high. It's not normal to have a high ketone level if you eat carbohydrates. So it may look like it's abnormal on the test, on the report, when it's normal for you when you're in ketosis. It's okay. It differs from usual medical care in so many different ways that it seems abnormal. But it's normal. The weight loss actually is achieved by lowering the caloric intake. There's no mystery. It's not magic. The glucose and insulin levels, diabetes improve, which is normal. We want that to happen. The triglyceride HDL and lipids and all, a little confusing there. I have a special slide on that one. I want to do an hour-long talk to tell you my take on all of that because it gets complicated. But just a quick view into what normal means. In most lab tests, it means that you're outside the middle of this normal distribution. So you're going to have 2.5% of people look abnormal just out of the statistical distribution for most lab tests. And the meaning of normal is, usually what is commonly observed. He normally goes to bed at 9, right? Families these days normally have 2 children. But it's also used as a biomarker correlation, abnormal correlated with ill health, like temperature of 102 degrees Fahrenheit is a fever, or abnormal prevents future hazard, and it's called we call that a risk factor, and that's getting into the cholesterol. High LDL is a risk factor for heart disease. Best would be if we had a therapeutic correlation for when you take action, that the abnormal is the point where treatment does more good than harm, and that's rarely used in the medical world, unfortunately. So this fellow is what's commonly observed normal relative. This fellow is short in Sweden, next to Andreas Enfeldt. Oh, that's me in the picture. And then I'm tall in China, here with Professor Zhang, Dr. Zhang in the Central Hospital of Shenzhen. So normal is relative. I'm abnormal in one place, no, both places. Normal in the US in terms of height. So the biomarker correlation has been like the LDLs and the triglycerides and all that. It's not a disease. Biomarker correlation is something that has a correlation. So it doesn't mean that the same test can be used. So let's say your white blood count is high because you have an infection. That's normal. But if you don't have an infection, the white blood count is really high, it might be leukemia. So we actually look at the context of the number that we get. That's what our training does. Outcome data may not be available for all of these different factors we treat. Many types of data must be simultaneously considered. For example, a blood pressure of 96 is okay in someone who's older, or even younger if it only is occasional. That's why we have 3 different measurements before we diagnose high blood pressure. And a temperature of 101 might be greeted happily if the prior was 103 Fahrenheit, so the fever's coming down. So this is why you just don't ever want to take a number and freak out about it. For example, when blood pressure monitoring came out some years ago, I was faced with this. People took their ambulatory blood pressures at home and they came back saying, my blood pressure went up when I exercised. That's how I know. It's supposed to go up when you exercise. But I'm worried because my blood pressure, what? Because my blood pressure went up. So if you start measuring what's normal biologic variation and freak out because it's different than what the diagnosis in the medical world, so don't just discuss this with your doctor who knows about it. So now people have all these glucose monitors and CGMs, and people are asking me to prescribe them even if they don't have diabetes. I don't really recommend that because it's normal to have blood sugars go up and down, and especially when you're not eating as many carbohydrates, the blood sugar is going to be a little more volatile. I learned that from Dr. Richard K. Bernstein, who had been looking at blood sugars for years in people who don't eat carbohydrates. So don't freak out if the blood sugar just goes up a little bit or is even over 100. At this last meeting I went to, I think the most common question I had is, what do I do with my blood glucose of 106? Which is just a little bit of it, it's pre-diabetes. No. So don't take the range of the carb eaters and apply that to the range of the low-carb keto eaters. Keto normal is different. We're getting more information about what happens in ketosis. This is the Hallberg study. It came out last year. Beta-hydroxybutyrate in the blood. You can measure ketones. They're elevated, and they can go down over time, and not everyone has elevated beta-hydroxybutyrate. It's okay. So this is a biomarker figure from that same study in 2018. Everything gets better in nutritional ketosis, except one thing, the total LDL. That was the second most common question I got at the most recent low-carb keto conference. What about my LDL? Well, it goes down 2/3 of the time, but 1/3 of the time it doesn't. But everything else goes in the direction of improvement, except the calculated LDL. Now you can check the small LDL and the particle number and all that, or rely on the idea that keto normal is different. So keto normal for cholesterol, this is the question I've gotten so many times. Everything got better, but my doctor wants to put me on a statin for a high LDL cholesterol. Have you ever heard that? Yeah, okay. Thank you for 10 hands going up. This is why it doesn't matter. Keto normal for cholesterol, because keto normal addresses the metabolic syndrome. So actually years ago, Jerry Reven at Stanford, who was not appreciated in the medical world, and now Jeff Rolick at the University of Connecticut and Ohio State, they knew, and Jeff Rolick knows, Professor Reven has passed,
What does that say?
metabolic syndrome here in yellow. Metabolic syndrome is keto normal. So you don't worry about the LDL and total cholesterol, you worry about triglyceride, HDL, abdominal obesity, blood pressure, and glucose. So the old way of looking at it, you would only focus on the LDL and total cholesterol. And so the quote normal old way of looking at it is the way your doctors, dietitians, maybe, or other like grocery store clerks are looking at you. What is your LDL eating all those eggs? I've had someone ask me that. I said, don't worry, I'm a doctor. And they laughed. So don't worry about the LDL total. The new way to look at the lipid profile, well, it's not so new, it goes back a long way, it's just been underappreciated, is to look at these other factors. In other words, if your triglyceride and HDL are fine, don't worry about the LDL. Okay. So to sum up, keto is safe and effective for obesity and type 2 diabetes. Keto is showing clinical value for many other things other than the well-established diabetes and obesity in the literature. Keto works for virtually everyone when it's done right. I say that from the data from the HEALcare clinics. A new specialty, keto medicine, may be needed to train practitioners for the skills in nutrition teaching, counseling, and de-prescribing, which is the term for taking people off medication. And caution is required when comparing labs for those in nutritional ketosis to normal values from those who eat carbohydrates. But I think that's going to keep me in business for a while. and it's people fly all over the country to come to me to explain metabolic syndrome, insulin resistance, and LDL cholesterol. They're just different ways to look at things. Thank you very much. And thanks to Heal Clinics for helping out tonight. Thank you. So, any new folks tonight? You want to come up and say hi, who you are, why you're here? You're welcome to at any time. Any folks who have stories to tell, wanted to come? Come on.
Push me out of my chair.
Well, I literally just signed up.
Awesome.
So, I just signed up, talked to you, 2 weeks ago. Talked to Eileen Friday, I think. Yeah, she's my partner. And my biggest thing is just inflammation, and I just haven't felt it. So I cut back last fall off of sugar and carbs, but everybody who works on me, because I have disc degeneration disease.
Can you hold the microphone?
Oh, sorry. I've got a massage therapist, I've got chiropractor, and they were telling me during that short time that I cut back how well my body felt. So I decided after the holidays and after everything was going on that I was going to do this. So I found Jude in Charlotte. So through my chiropractor, by the way, it was kind of funny. And she gave me the card, and then I called. And I thought I was just going to do it like everybody else and just kind of wing it. And then I started talking to everybody. I was like, oh, I'll sign up. Let's see what happens. So I'm already down 7 pounds. So,
Is it hungry one?
yeah, hunger's on. My problem is I'm not hungry. I've never been hungry.
Oh, okay.
I've
So it's
never.
not new, but for a lot of people that's new.
Yeah, I've never been force-fed. I've never had. My family just hasn't had that problem, but carbs We all love carbs, but my body doesn't like carbs.
Great. Keep it up.
That's it, so.
Thank you.
Most people wouldn't think going to the gym without getting a personal trainer these days. This is kind of like just getting a personal trainer to help you with the lifestyle change having to do with diet. A lot of people are surprised to find that you don't need to exercise to do this. And at first we don't emphasize that because you don't need to exercise at first. A lot of people don't even have the energy to do it. So why, flog people? Any other new folks want to come up and say hi? Come on down. I gave a talk last week at the chronic pain organization. They're already using it as practitioners to help treat conditions like fibromyalgia, back pain, things like that. So hopefully that'll work for you. Yes?
Hey, so my mom is a patient of yours, Dr. Winston, and this is my second meeting. But I did this to support her, and I lost 20 pounds. But the thing is, I was on, I had acne, severe acne, boils all over, and I started having acne and I think PCOS symptoms when I was maybe 16. And I went on Accutane, and I was on steroids and the medicine. And with keto, my acne went away. And I was able to come off I was on spironolactone, so I was able to come off completely. So,
Fantastic.
yeah.
Thank you.
Thank you so much. There are no studies about keto and acne, so it doesn't work. Thanks for laughing. I'm not good at sarcasm, but I'm at the heels of that. So, in fact, a dermatology professor at Duke came to me some years ago and said, there are some cultures, he goes to visit this place in South America, where they don't have acne. Teenagers don't get acne. And he said, it's because they don't have sugar. He said that the skin doctor was telling me after I thought I was really, knew everything, and, actually, so I think that's one of the unsung or unknown, real, potentially really helpful roles for a keto diet, to help people not have acne in that part of their life. It can be really, really impactful. Thank you. Other new folks, come on down. I even met a doctor at this, it was called the American Society of Interventional Pain Practitioners. They mostly treat people with really bad pain and give steroids and shots and things like that. And they were already using a keto diet for many of their patients and getting people off the pain medicines, which is really great to hear. Any other new?
I'm not new, but I have a question.
Yeah, or you want to come down so everyone can hear you? Or I'll repeat it. Come on down.
So I've been doing keto for about a year now, and I lost 30 pounds, and I've kept it off for 6 or 7 months. But, and I wonder if it has anything to do with it. Now I'm noticing that my hair seems to be a lot drier than it used to be. Does that have anything to do with it? Just like with the acne, you may not know have anything to do with hair.
So most people, well, everyone who comes through in my program will have certain drug, we'll talk about drugs, but they'll have certain laboratory measures checked. And the things that come to mind with dry hair is the thyroid level, and then the liver, kidney function. We check all that when people come to our program at the beginning. So that's something to think about if you notice something like that, skin being dry, hair being dry, if you haven't had a thyroid level checked, and the thyroid level is okay.
Everything's okay.
So the deep dive into the thyroid is if you only check 2 of the 3 levels, you may be in the 5% of people who have a low T3, but their T4 and TSH are normal. So it kind of depends. So the weight loss is stalled, and
Oh no, my weight loss is great.
Okay.
Yeah, no, I'm maintaining. I'm
Okay.
happy with that. It's just the hair.
Yeah. Okay. The other thing about hair that some people mention hair loss. It doesn't happen very often, but it's called telogen effluvium, T-E-L-O-G. I read it out for people so they can just Google it or Wikipedia it, and it's the stress-induced hair loss that happens with any stress, and it will come back. But so the stress of weight loss, it's not just keto. If you lose weight by any other method, telogen effluvium can happen, and what happens is you just have to wait, and the new hair comes in even better than before. So, any other questions? Kind of how are we doing for
Here's some questions from
Okay.
online. Will keto help my RA? Mary Ann asks.
That's a great question. Will keto help RA? You look in the literature, fasting can help rheumatoid arthritis. Have you heard of fasting? Well, it turns out that the metabolism of fasting is fat burning. And that's the same metabolism as keto. So it hasn't been directly studied to my knowledge. And I had these two, what I call credible anecdotes, meaning either it was another practitioner or someone I know who isn't just making it up, or someone presenting me just a solid description of what's going on, a picture at a meeting. And so what I've seen is, and this is anecdotal, doesn't mean it'll work for everyone, but I've seen the resolution of pretty bad synovitis. If you know what that is, you can get swelling of the knuckles so that you don't even see the knuckles anymore in rheumatoid arthritis. And this individual had improvement in one of her hands over about a 1 year time on a keto diet. So I guess I'd have to say maybe. But I'm comfortable enough. Remember, keto is safe. While I won't guarantee it helps for a certain condition, I will help you learn how to do it if you want to see if it will help a certain condition. Does that make sense? So yeah, I would try it for RA or the other ones that there's no data published yet, but I see signals, Crohn's disease, ulcerative colitis, which are the real serious inflammatory bowel diseases. There are signals, credible anecdotes of folks. And then my method is to, when I get 3 to 5 credible anecdotes, we'll put it into a paper and publish it in the medical literature. And then that basically gets the information out in a way that then the other people, other medical doctors know that it's possible, and then other people may see it. And that's just one way to start changing the world.
Ellen says that job-related stress seems to be affecting her progress. She's following the protocol, but still feeling hunger.
Yeah, so stress can cause hunger, or the perception of hunger, no question. And that's pretty common, that you'll just eat more, or you'll want to go back to the old ways of managing the stress, carb eating, which is so commonly done. So we usually just help people find other ways to manage the stress other than eating. And that's a whole nother, the stress management side of the coaching. But yeah, I think stress is a big deal. So try to de-stress.
That's what I was going to say, because my issue is not stress eating, but more boredom eating. And so if I'm bored, then I'm suddenly hungry, or I think I'm hungry. So I have a little technique that I use, and it's called, "Are you hungry enough to?" And so I laugh about it, but it is, I don't like cleaning bathrooms. And so that's my hungry enough to. So I ask myself, are you hungry enough to clean the bathroom? And if I am, then I clean the bathroom, and then I can have a snack. But most of the time, if I clean the bathroom, I don't want the snack afterwards. It's just because once I got up and got busy, I forget about the snack. So that's, we have to come up with little techniques to use to make sure that, and this, I'm 3 years in, and those are the kinds of things that I do just to check in with myself. So it's not like, we learn this, and then we start eating this way, and all of our other little habits go away magically. We still work on those every day. So.
That's right. Other, yeah, come on in, honor.
I'll just stand here. Has Dr. Hauber published her 2-year data yet? And if not, do you know when that might be coming?
Has Dr. Hallberg published their 2-year data yet, and when will it be coming? Sorry to say, I don't think so. I saw a presentation just over the weekend with I think it's the unpublished results. So, I mean, it looks great. You know, for those who stay on it, you know, which is a recurring theme, you know, if you don't take a pill, why blame the pill for not working, right? I mean, so, so the Hallberg paper, Sarah Hallberg is at Purdue, and they did one of the best studies of nutritional ketosis, meaning they knew people were in nutritional ketosis, and so all I know is that the results look good, like you would expect. I heard a talk.
Yeah, I saw her on a YouTube video, and she seemed pleased with the results,
Right.
but I never heard that they got published yet.
Yeah.
So,
Technically, we're not supposed to, give away those.
yeah, I know. But she seemed happy.
Yeah. I saw Jeff Stanley, who's one of the physicians with Virta over the weekend in Seattle, and he gave a great talk on de-prescribing medication. So you want to be careful if you're using this kind of approach in diabetes, and you want to monitor the diabetes and reduce the medication, de-prescribe it, sometimes very aggressively, because you want to avoid the low blood sugars that can happen with diabetes. Again, the Hallberg study is only looking at diabetes.
But everybody lost weight.
And people lost weight, yeah. Right, but having diabetes was a precondition to get into the study. It wasn't looking at obesity or other conditions. Yeah. I wonder maybe while you get up the gumption to ask a question, if there are another. Let me just give you a couple minute story about this trip I had to Jakarta. The first low carb Indonesian meeting happened in Jakarta. And I really don't know Asia well, so I'm learning about Asia and where it is and all that. And Indonesia has as many people as the US, just on various islands. And so they have this group called Keto Fastosis Indonesia. Keto Fastosis is because they're doing fasting or time-delimited eating with keto, because it's actually with the 80% Muslim population, fasting is part of their religion. And so there was a dad, Mas Tio, brother Tio, who was faced with his son. The doctor tells him that he's not going to be able to walk or talk because of cerebral palsy. And so he's looking, and he had some seizures as well, I just learned. So he looks to the doctor and says, well, what's wrong? What happens in cerebral palsy? And they said, well, it's a problem. There's not enough myelin in the brain. And so the TO asked the doctor, well, how do you get more myelin in the brain? And the doctor says, well, we don't know. We don't. You can't do anything. Just go home. Sorry. Well, engineer that he was, and I've learned a great saying, which is, bridges don't fall and crash because they don't want to stay up any longer. And you can't blame a bridge for falling because of poor willpower or all that. So don't blame a patient for something. But so the engineer in him said, well, how do we get myelin and cholesterol in the brain? Ketones. Actually, ketones are used as the building blocks that go across the blood-brain barrier, go into the brain, and are made into cholesterol and myelin. So he looked around, did some research, and there's this thing called the ketogenic diet for epilepsy. Turned out Alif had epilepsy too, and so he put his child on the ketogenic diet, then learned that it helped for weight loss, lost 50 pounds himself, and then started teaching people. Just the kind of guy that he is. He went around doctors' offices, went around to meet with other people, and so 10 years later now, there are over 350,000 members of their Facebook group, Keto Fastosis Indonesia, and he decided to put on this first conference. So Georgia Eid and I were invited from the US. Gary Fetke was invited from Tasmania, Australia, which was fairly close there. And then they had 3 Indonesian doctors giving lectures as well. And I had the translator in the ears. 3 days of meetings, conference, and I never had so many selfies done in my life. And other people with me. I didn't know that you could do, oh wait, another one. they treated us like we were celebrities. Of course, not celebrities. It's TV. It's not a movie. It's reality. And so we're 3 days in the meeting, kind of exhausted, and then we're all standing up on the stage, and then there's this kind of murmur. 350 people in the audience, all enthusiastic, and then this kind of murmur because Alif was over on the side they said, come up on the stage, and he walks up on the stage to show that in disbelief, the doctor said he would never walk, he would never talk, and there wasn't a dry eye in the place because everyone knew that this was the kid, kind of like Charlie Foundation in the U.S., kind of like the movie Lorenzo's Oil, where the parents go out and have to figure it out for themselves. Tio figured this out, and his son's walking and giving back to the community there. And Georgia E. did a great blog about this whole, if you don't know her name, it's EDE, Georgia E. She's a psychiatrist. Did a great blog, just posted a day or two ago about the whole trip. Please check it out. Also check out George's blog, just because it has great information about the keto diet. And anyway, it was a fantastic experience to be there and to see how, what can happen, and you really can affect so many different things, including all of these different, I'm waiting for research on all these because I have a foot in the academic world where we need this research to be able to talk about it in certain circles, but just to see that kind of experience was very inspiring for me, and to be able to share that with you. So, they don't have the other doctors saying don't do it, the other people saying, second guessing you. So just tell those people thank you for your advice, but I'm doing fine. And the last thing that they said is that I'm living proof. So they would go around and just say, I'm living proof, I'm living proof, I'm living proof. It's not an anecdote that we dismiss in the medical world. I'm living proof. And that sort of experience is valid. It matters. And that's from Indonesia. Thanks. Yes.
You didn't have cerebral palsy on your list. That's, I suppose, a credible anecdote. Do you have any other?
Yeah, so I wouldn't say that's a credible anecdote for me. Because I wasn't there, didn't validate the diagnosis and all that, but it's still a great story. So for me, I don't hear a lot of signals there are signals for autism, and in the movie The Magic Pill, they gave a great story of a child with improvement. But yes, I have written not in the medical literature circle, but in other places I've written about what is a credible anecdote. And how many of those meet the criteria for then someone, for me saying, hey, yeah, it might work. Yeah, no one really knows where most doctors will just dismiss those things. But I've seen enough credible anecdotes get confirmed by later research. And then, other research just will validate that it works for more than one person. For example, we're monitoring and following someone who had the resolution of schizophrenia after 8 days of the diet, and that has been gone for almost 10 years. So in that individual, it worked. But to be able to say it's going to work for someone else requires experience with more people. Now, in that area, Chris Palmer at Harvard has 2 other cases, just that he's paying attention now and he's treating people. And so hopefully that will grow, and even maybe there'll be some research, formal research done with placebo controls, hopefully, to see if it will help with schizophrenia. But so I'm not ready to sign off yet on the cerebral palsy, even though it was a great story, I have to say.
Well, maybe I was wondering if it was kind of one of those hints type things.
Yeah, it might be. It might be. And I don't know that in the U.S. a doctor would say anything different. As there's nothing you can do at this point. But Other questions? Come on down. Yes.
Pardon me, will the ketogenic diet prevent or lessen the risk of dementia?
Will the ketogenic diet lessen the risk of dementia?
Or prevent it?
Or prevent it? That's a great question. Based on the insulin resistance theory of Alzheimer's and memory loss, it might. But the studies are pretty early to be able to say that it will. So we're holding out, we're hopeful that it might. It turns out that something like Alzheimer's, which is a pretty serious memory loss and dementia, it starts 20 years before the first symptom. So you want to, just stop eating carbs now is my or do something that improves the insulin resistance now, well before you ever have a symptom. Which then that kind of gives me some caution or doubt that maybe once you get a symptom that it's going to really be helpful because it's been going on so long. But, yeah.
How long do you have to have, our average person have to have been doing the ketogenic diet faithfully to realize the results, including possibly eliminating the risk of dementia?
Yeah, so how long does someone need to do a keto diet to get results, especially with dementia? It depends on what the problem is, right? Hunger goes away in a day or two. So appetite control happens pretty fast. Appetite control happens pretty fast. Triglyceride reduction in the blood glucose reduction happens pretty fast. No one really knows about dementia, although it brings to mind the credible anecdote of Mary Newport and her husband, where she started giving him coconut oil, and then she started speaking about coconut oil and dementia, and sadly then he worsened, but that even brings up the idea that you might add in something other than just changing the diet. But again, that's kind of really early research there. But I would think it probably would have to be a long time for prevention of dementia, but I don't know for sure. Other questions? How about in the back? Always, great. Well, how am I? Anything going on?
Yes. Ricky says, because of my high blood pressure, I cannot have added salt. I worry about my sodium intake because my understanding is sodium and potassium are important to keto.
Okay. Well, so the sodium issue, early on, we recommend salt replacement or bouillon when you're transitioning from carb burning to fat burning, because it will just minimize your chances of any symptom of headache or fatigue. And we don't recommend people with high blood pressure or heart failure to add the salt or bouillon because it is salt, because it can worsen those conditions. So that's early on, most people don't get those side effects, so I don't worry if someone doesn't take bouillon because they have a high blood pressure issue. In fact, I don't ask people to replace salt, magnesium, or potassium unless they have a symptom. So there are some programs that'll say everyone should take a supplement because a third of the people have a problem. But that means 2/3 of the people will be taking a supplement that they don't need, but they're buying the product that they want to sell. So, it depends on your point of view. If it's worth it for you to not have a symptom, to take something to reduce your chance from, 1 in 3 to less than that. I usually wait until there's a symptom like muscle cramps or constipation before I add or tell people to add back electrolytes. It's just a different style. Yeah.
Someone mentioned to me the other day, because for this, actually even before I started on this, I've been using sea salt, and then when I started on this, I started using the pink Himalayan salt. So, I don't use the iodized salt that we always used before. Is that a problem?
Yeah. So, what about the salt? What kind of salt's best? Pink
Because it's
Himalayan,
not iodine.
without iodine, with iodine, and red numerous blogs about this is better, that's better, it doesn't matter which one you use, and I don't think it really matters which one. If you're eating great nutrition, otherwise you're eating excellent foods, it doesn't really matter what type of salt.
I don't need to take a iodine supplement or anything.
Yeah, I don't think so.
Okay.
Yeah.
Does Dr. Westman advocate getting a CT calcium scoring test done?
Oh, right. So thanks, Julie, for that question. Are you familiar with what the coronary artery calcium score is? Yeah. Some heads this way. Well, the coronary arteries are an area that can narrow and then cause a heart attack. You can have narrowing of the arteries going to the brain, all over the body. If it happens in the heart, it can cause a heart attack. So how do you measure whether an artery is open or closed? Well, you can put a tube in the artery and do a heart catheterization, and you'll know if the arteries are open or not. You'll see directly. But most people don't want to go through a heart catheterization. You have to be in the hospital, it costs a lot of money. You usually don't get that unless you've had chest pain or they think you might have had a heart attack. So how do you know if you have a problem with your heart? Well, you can go on a treadmill test, right? Have you ever had a treadmill test? They ramp it up and get you sweating and exerting and monitoring the electrical activity of the heart. And if you fly through that, they say, well, if you do have a blockage, it's not bad enough to bother you doing that, so we don't worry about it. But they still don't know about whether you have blockage or not, because they haven't measured it. So one way to get it, it's not actually directly measuring the arteries, and this is why I've gone through this long story and explanation, because calcium can build up, but calcium can build up on the arteries of the heart, but it doesn't necessarily mean there's blockage. But it goes along with blockage, but not always. So the calcium, the CT scan of the coronary artery calcium score is really good if the score outcome is 0. So if you get the test and there's no calcium, your risk of a heart attack over the next 10 years is basically 0. If it's really, really high, your risk is high. The problem with the test is that in the middle, it's not such a great test. So you can have the calcium and not have blockage. And vice versa, you can have bad blockage and not have a whole lot of calcium. So it's in that gray area of, if you get the test done, discuss it with someone who's familiar with it, because actually it can change over time and not always in a favorable way. But there is one cardiology guideline now that includes the coronary artery calcium score in the guideline for management of people at high risk for heart disease. So you might want to ask your doctor about that. In the book Cholesterol Clarity that I wrote with Jimmy Moore, or Jimmy Moore wrote it and I helped, we have the story of you can also get your arteries checked by ultrasound measurement of the neck and aorta. And ultrasound doesn't have any radiation exposure, and in our area you can sign up. The company comes in the dark of night in the fellowship hall, the churches, and for the mere $150, they'll scan these things. The reason they do it in these places is that if it was in the medical world, it would be much more expensive, and doctors don't recommend that. But so if you want to know those things, you can use ultrasound or the calcium score of the heart. So I guess this question is, do I recommend it? It depends. Which is that's the internal medicine specialist response. Because it depends whether you're, low risk, medium risk, high risk, what your situation is. I think you can just go out and, talk to your doctor and have them order it and get it. But then be careful in how you interpret it. Let's see, a friend of mine, Jeff Gerber, and Ivor Cummins wrote a book, and it prominently featured the CAT scan coronary arteries calcium score in that book. So if you want to do a deep dive into that, Jeff Gerber's book would be Eat Rich, Live Long, something like that, is the name of the book. Came out last year, I think.
Jill says that she is grateful to her coach Sherry, her HEALcare partner Mary Lou, and Dr. Westman. She's been off her diabetic medications with keto now with their help, and her weight is steadily coming off, and she is happy, happy, happy.
Fantastic. Thanks, Jill. Yeah, that was a pretty typical response. Fantastic. Thanks for coming out tonight. And, oh, come on. Yeah.
What about leg cramps?
Leg cramps.
Yeah, I had my physical in February, and I've been on this since the 1st of January. I was not having leg cramps. My potassium came back good, and I had told her I was taking a potassium pill. She said, you don't need to take that anymore. So I stopped, and then I started having some leg cramps. Even though my level was good, I was having leg cramps. So, I don't have them all the time, but I do have them.
Okay, yeah, so if you're starting, a few weeks into a keto diet, maybe, 10% of people will have leg cramps. You're thinking potassium, potassium, potassium. It's actually magnesium, magnesium, magnesium.
I started that now. So.
Magnesium facilitates potassium, so they actually kind of work together. I know most medical providers don't think magnesium, they think potassium. That was something I learned from the obesity medicine world. And one way to get magnesium is through that Phillips Milk and Magnesia in the blue bottle. A teaspoon of that at bedtime for a week works like a charm. It's actually my go-to remedy for not only muscle cramps, but constipation. It's because it works so fast, but the long story is if that's happening a lot, you need more salt and water.
I don't eat more salt, maybe water. I eat a lot of salt.
Well, so it turns out that bouillon, giving salt in some way fixes lots of things, including constipation and muscle cramps. But milk and magnesia will work as well.
Okay.
I even had one HEALcare patient who fixed her own really, really lifelong cramps and wrote an essay about it. And she went through magnesium, potassium, and all this, and it was finally the salt that fixed it, the bouillon cubes. Yeah, so if you're having trouble with cramps, you might be able to fix cramps you've had all your life by just getting that little pearl from the nutrition and keto world. Yeah, in the back.
Heartburn. I had heartburn for maybe 3 or 4 days.
Heartburn?
Yes.
For 3 or 4 days?
Yes.
After starting keto?
Yes.
And was it related to something you ate?
No, unless it's the meat skin. I'm not used to eating a lot of meat
The meat skins? Yeah. It's not a common thing that I hear. If it's
cinnamon. Somebody said the cinnamon might be a problem.
cinnamon, I don't know. Yeah, from just about everyone, the heartburn goes away. I mean, it could be stress. Could be an osmotic thing, meaning if you're having, the pork rinds might have the salt that makes it, so it's not an acid thing, but it's a osmotic thing. Is it persistent? Or did it just come and go?
It comes and goes.
Yeah.
Some days it's worse than others.
Yeah,
So
so,
drinking hot tea or something with no sugar, open ginger in it, because I heard ginger is good for your stomach, cell.
yeah, so when you're trying to troubleshoot a symptom like heartburn or other sorts of things, it can be helpful to just kind of make a diary of what you ate that day, what you did that day. If someone's trying to troubleshoot it, that's something that might help you figure it out. Yeah. Yeah.
Is there such a thing as too much protein
Is there such a thing as too much protein?
in the diet?
Sure. Yeah, so there is such a thing. You can eat too much protein. It's very difficult to eat too much protein when you're hungry and follow what your body's telling you. So, and that's the general principle of the HEALcare system, where you're not really counting the protein that you eat. You let your body tell you how much to eat. There was a study, I know it's ancient history now, but like my midlife, mid-20s, in the 2000s, where the people put onto a research board ate the protein, matched the protein to what their size was, what they needed. Imagine that. So it's possible to eat too much protein if you're pounding protein shakes, like thinking that, oh, I'm not eating enough protein, I need to have more shakes of protein. Try to get your protein from real food as much as possible, and it'll automatically figure itself out. Yes?
Well, just a quick success story. I started keto on January 29th, and as of today, I've lost 36 pounds and still going.
Fantastic. Just for the viewing audience, since January, you lost 36 pounds.
Yeah.
And any other bonuses? Like, do you feel any different?
Yeah, my energy's up. My clothes don't fit. Yeah, I'm feeling good.
Fantastic. Thank you. Yeah.
Did you say 1 teaspoon or 1 tablespoon of milk package?
1 teaspoon. Usually a tablespoon for most people will make you go that night. Yeah. So if you're using it for leg cramps, you're not going to use it very long. It's a teaspoon. Yeah. Or the old, just a little. You're the only one using the container. Excellent. How are we doing for time? About 9 more minutes. Any other? Yeah.
Allergies on keto have not been as bad as they have before keto. Anything to that?
So your allergies, what kind of allergies?
Like hay fever.
Hay fever is better on keto than before. I hear that a lot. No studies published that I'm aware of. And the reason why it may actually be real, a lot of people told me that, credible anecdotes, and the way to think about it is that if you reduce inflammation of any kind, you're going to be less likely to have an allergy symptom. So if you have an underlying amount of inflammation from the food, and then you have the allergic response, it all builds up and then spills over into a symptom. So you may be still having that allergy response, but you're not at that level yet where you get a symptom. Yeah. Has anyone else had allergies get better? Just raise your hand. Has anyone else had hay fever get better, allergies? Yeah, so 5 or 6. Yeah.
I missed some of it. Did you share the findings you had over the weekend or last week regarding pain management?
Yeah.
The research on pain management.
Well, I mentioned speaking at the pain management conference, and that there is some research on the mechanism overlapping, epilepsy treatment with pain treatment. Same medications are used, and yeah, there's actually mechanistic rationale for why a keto diet would help with chronic pain. Yeah. Yes.
It's kind of actually allergy, but I didn't have allergies. But after I went on the keto diet, I discovered that I got rid of a post-nasal drip that I didn't know I had. I'd had it all along, where you kind of feel that you have to swallow or whatever. But then I realized that wasn't there anymore. So,
reflex.
Post-nasal drip. So you fixed post-nasal drip that you didn't know you had.
I was aware of it, but I didn't think it was a problem.
It was just normal.
When it went away, I went, hey, that's cool, that went away.
Good. Yeah, well, just related to that, at this time of year in the spring, I think 10 times I've taken away Flonase nasal spray from people because they stop the weight loss or they start gaining weight, and I just ask them, is there anything new? Not Flonase nasal. Well, it's a steroid, and steroids, when absorbed, can block the weight loss. And if you don't think anything can be absorbed through the nose, actually it's a very efficient way of getting drugs inside. So watch out for Flonase nasal spray is the take-home point.
What about potassium levels on keto?
Yeah, so I don't think you have to worry about potassium levels on keto unless you're on a medicine that depletes potassium. They're pretty commonly used. The most common one is a diuretic. If you're on a diuretic that depletes potassium, in a program like mine, we would measure it and we would replace it. Another common medicine in our area in a clinical setting is furosemide or Lasix. So if you're on those medicines, be sure to measure potassium. But I really don't worry about it if you're otherwise healthy and are not on a medicine like that. You know, I've come to think that, you know, keto is safe. This is just healthy eating. What's bizarre is the current American way of eating. This is just going back to the natural, you know, more natural way of eating in my mind. So.
Someone mentioned that their asthma was improved.
Asthma gets better. I think that's the same. No published trials about it. Credible anecdotes, yes. I have vivid memory of someone in my second clinical trial, you know, improving a lot, gone, asthma gone. I think it's an anti-inflammation effect of the keto diet.
Well, I was going to say that there's one other thing. We've had this discussion before, but a year ago in January, I quit smoking. And I laid my cigarettes down, and someone asked me 3 weeks later how I was doing with not smoking, and I was like, oh yeah, that's right, I used to smoke. I mean, it was that easy. And I swear it had to be with keto, because I had quit smoking, I can't tell you how many times before over the years, but I literally walked away and have not thought about it since. It's gone. So I think being keto, plus having been through the HEALcare program for me and being through coaching and understanding my big why I'm doing this, why I'm getting healthy, made a huge difference. So I think you should write a paper on that too.
I have another credible anecdote of keto diet and smoking cessation. I mean, that's my former research life of helping people quit smoking. Interesting. It would be nice to merge the two in some research. Yes?
I just want to say we missed you at the meetup group dinner this week.
Oh, right. So tell us about the meetup group.
It was wonderful. One of the ladies, she couldn't be here tonight. In fact, she's going to try to come next month. She's a chef, and so she offered to have it at her home, and there was 12 or 14 of us, and a lot of really good keto recipes. And it was really a nice evening. And
Excellent. How does someone learn about the meetup
it's
group?
let's see, Durham Low Carb Meetup, I think.
And where do you go to learn about meetup groups? If someone
That's the one. Yeah, it's a meetup. Go to meetup groups, and it's
like meetup.com?
Yeah.
Okay.
And it's Durham Low Carb, and Amy Berger is kind of running the.
Fantastic. And Amy Berger has spoken here at this
Yeah.
support group.
And
Great.
she was there. There were some people that had not been to the meetings that I think are going to start coming. And it was really a nice dinner, and it was well worth going to. What it is they're going to try to do meet up once or twice a month to go out to dinner to places where you can learn how to eat keto. But this lady had offered to have it in her house. So.
Great. So check out the low carb meetup group. Thank you. Yeah.
I know you promote Adapt bars. I ordered some, but the MCT oil raises my blood pressure. Why does this happen? It landed me in the ER one time. MCT. Both times she had MCT.
What does that have to do with the DAP bars? So, anyway, two different points there.
Yes.
So MCT, I don't know a lot of data publications about MCT oil, and it's not really part of any recommendation that we do. I didn't know that. I mean, it's interesting to learn. Anyone else have information about MCT oil and blood pressure elevation? I'm not sure. Okay, sorry. Excellent. Well, so are we here in 1 month?
1 month?
1 month?
Yes.
Oh, you know, I had a question. Would anyone like to become part of a one evening research study? Research study meaning you get your blood ketones and glucose measured. You eat something or drink something. It might be a meal here, or it might be a product. So you get randomized to one or the other. And then an hour later, so then you come, you listen to the great talks or whatever is going on, and then you get it checked again. Is anyone interested? Well, that's 1 to 2.
As long as it doesn't have carbs in it.
As long as it doesn't, no, that we'll guarantee that there are no, it's keto friendly. And so we're just talking about an idea of testing products, and then we can have like a lineup of products tested against meals to see what happens with glucose and ketones, and then you would find out about it as well. So we're just considering that as a concept.
Do they stick you with a needle?
Well, the way we measure blood glucose and ketones is a finger stick. So it's just a really tiny amount. So there is momentary, yeah, you'd have 2 of those measurements an hour apart, and free food, of course, or the bar or shake or whatever. Because there's one way to know how to give a recommendation. I mean, so you might have tried something and said, oh, it didn't do anything, but then you told me, oh, it changed my keto. How do I know what to recommend? So if we get, say, 50 people, and then we'll have a greater certainty over different kinds of people what that product or meal will do. Interesting idea.
You want to take names?
No names needed. It might not be next month. You gotta get the research proposal together and all that. And we'll probably give you a heads up beforehand. It might even be a reason for people to come out and see what happened to their ketones. Is anyone measuring their own ketones at home? Yeah, so about 6 or 7, 8. Oh, question?
I actually have a ketone question. Because I've been doing this for about 2.5 years. For the longest time, my ketones were like 0.5 to 1. And then it seems like the longer I'm on the diet, the more the ketone level kind of inches up. And I was just wondering if you've heard anything about that, and that's kind of normal.
So the question is, what about ketone levels as you've been doing this for a while? And you've noticed that your ketone levels kind of are inching up over time, but still under 1?
No, now it's closer to like 1.5.
1.5, still under 2?
Yeah.
Right? So you're in uncharted water. So no one has followed just 100 people over time to see what happens over 2 years. So I think what we're hearing is that is fine to have even variations of ketone levels. No one really knows what level you need to be at. And even then, I'm not convinced yet that you have to be in ketosis. I'm not sure if adding things to make your ketone levels go up are really necessary or have added value. That we're in that area where the science is being envisioned, but it's not done yet. So good for you to stay on it. Have you found it hard to do?
No.
Great.
I haven't changed my diet really, and like I said, it's just kind of a little bit higher over the months. Every couple of months it'll go up a little bit more.
So the ketones just go up. And how about the blood glucose? Do you check that too?
That's been pretty much the same. I don't measure that as much as I used to, but I measure it every morning.
I wonder if one day everyone will be checking their ketones and no one cares what their glucose is. Because we're living in a world where everyone checks their glucose and no one cares what their ketone levels are, right? Because they're not there. But some people have even wondered if there might be a harmful level of too many ketones, like harmful level of too many glucose, and it's hyperglycemia. No one really knows. I'm not worried about it. It doesn't cause alarm in me to think that that's some your terrible thing, but that's why we're following and doing research as well, following people over time. I think that wraps it up, eh?
Yes. Thank you guys for coming, and we will see you next month. And if you need any information or if you have any questions about the program, feel free to go to healclinics.com, and we'll be happy to answer your questions. Thank you.